See, you're awake. Well, that's good. That's a good sign. Just come to give you a bit of a checkup. Make sure that things are going well for you. We gave you a shot a couple hours ago. So you're probably due for another one. Probably due for another shot today. Dr. Andrew Michaels is here. Been primarily looking at you today. And yesterday, right? Apologize, he had to travel somewhere. Have another outbreak going on halfway across the country, so he's going there to check on patients. And I've been put in charge with this facility. Oh, you've been here for about a week now, I think. You check your intake. I think it was about a week ago. Yeah, it's about 8 days ago that you came in here. Yes, you were the first patient. We've lost a couple in the past week, but you seem to be stabilizing, and we want to hang on to you for a bit and see if perhaps you might be the key to a vaccine for this very unfortunate outbreak. But, you know, we're gonna take a look and see how you're doing today. I know you had a little bit of a dip a couple days ago, but you've recovered quite well. You can tell that color is coming back into your face and all into your body. You were a little bit red yesterday, very flushed in your face, but looks like that redness has gone down. Looks like, let's see, your temperature. Slightly high, about 99 degrees Fahrenheit. Blood pressure cuff went off 30 minutes ago, and your blood pressure is normal. About 120/60. And see your oxygen level. It's about 97. Maybe we want to get it a little bit higher, but definitely improved. Your oxygen, I think, was quite a bit lower. Yeah, your oxygen was about 80 a couple days ago, so we've definitely made a huge improvement. Temperature is probably a little bit high because your body is still fighting off an infection. But we've had you in here, and luckily haven't exposed any of our staff to any of your infection, which is great. Oh, yes, we have about 100 patients here, give or take. I think the number is exactly 107. We've taken in a total of 150, so we've lost about 50 people, unfortunately. Yes, we're looking for a common theme between patients, how you may have contracted this very unknown disease. We're not entirely sure yet. But since you have been recovering very well, we may want to take a look at what's going on with you specifically. We've taken some samples from you, some blood and some other samples, and we're checking them in the lab right now, looking for possibly a vaccine or some type of antibody. I'm going to take some general observations of you. And get a general look at you. Definitely a bit thinner. Have you been eating any of the food we brought up? Not much of an appetite, but you're eating a bit. That's good. How would you say your appetite compares to the past couple of days? Is it higher, lower, about the same? A little bit higher today. How would you say bodily functions are running? Are you using the bathroom better, worse, about the same than a couple of days ago? A little bit better? Now, if you don't mind, I'm gonna put on some gloves and take some notes overall about how you're doing. I know this has been a difficult thing for you. We haven't been able to let your family see you for obvious reasons. We don't want your family to get sick as well. But you are improving, which is the most important part about this. I know it's been a little bit boring as well. We haven't been able to bring things in or out just because we don't want this infection to spread to other patients in our facility as well as other workers, such as myself, any other doctors. So we've been successful so far. No one else here has been affected that we know, so we're doing good. We are the only, now we're the second facility taking care of this illness. Like I said, Dr. Andrew Michaels went over the other side of the country to oversee another quarantine operation. Hopefully we can stop the spread. But we're still a little bit in the dark. We still don't know a lot of things about what's going on, but soon enough we will know. Your samples you have given us have helped us tremendously learn more about this illness and also make more steps towards a vaccine or towards a cure. So let me start a new observation worksheet for you. I'm gonna come up close, take a look inside your ears, and also feel around your neck a bit, see how we're doing. Alright, just gonna come around and take a look inside of your ears. Okay. I know you've been having some issues with very, very safe with how we're keeping everything sanitized. Everything. Don't even let our box of gloves come into this room. Then I'm going to take a look around your neck and back area. You did have a bit of a rash earlier, from what your notes said. And make sure that that rash has gone down. We applied a cream earlier. You were sleeping when we did that, so you have been sleeping a lot, but that's what needs to be done when we're ill, right? We need to be sleeping a lot. Make a note. Make a quick note about putting drops. a quick note here. You made a checkup on your rash. Gonna listen to your heartbeat and your lungs. We can decide whether your congestion has gone down as well. So, I just want you to breathe normally. Listen to your back now. Okay. All right. Very good. Now, I want you to take a deep breath for me, please. Good job. And now, on the other side, take a deep breath for me. Perfect. Now, another time. Good. Now, take another deep breath. Good. And another one for me, please. Thank you. Alright. Now, I wanted to ask you, did you feel any difficulty with the breathing? Did you find it painful or discomfort? Any discomfort at all? A little bit of discomfort breathing in deeply? we want to try to prevent you from getting any pneumonia. That's huge. Would be a very huge damper to your recovery. So I want you to keep practicing with your lung capacity device that we have given to you. Make sure you are practicing at least every hour, trying to really exercise and push your lungs. That way we can clear up that congestion. We don't really have a way of measuring it besides using that device, but it looks like from Dr. Michael's notes your lungs are a bit less congested than they were yesterday and much less congested than they were a couple days ago, which is great. So I wanted to give you your quick shot, so just put out your arm for me. It's going to be painless as usual. Here we go. And finished. That quick, that painless. Going to make sure we have the nurse bring you over some food within the next hour or so. I know you said you're not very hungry, and we want to make sure that you're eating and you're staying hydrated. We still have an IV hooked up to you, so we're going to keep that going until you are actually feeling a big increase in your overall appetite, okay? That makes sense. Make sure we have this room cleared up. We're going to be having someone come in and do a general cleaning a little bit later on today, and you can just sleep through that. We've instructed them to be very quiet, okay? So we're going to make sure that you get your rest and you're on the way to recovery. So suspect within the next week your family will be able to come and visit you. And now your job is to just get some rest and get better. Alright? Alright, it was great meeting you. And I will be your doctor from now on, so take care, and we are going to make sure you get better.